I'm going to spend the first 30 minutes just giving some general slides, everything I could think of to give someone an overview of COVID vaccination. And then the last half, I'll open up to anyone who has questions. I'm happy to answer as many questions as we have. So, you know, oh, let me go forward. There we go. I just want to show you a couple things to take an overview of what the situation is. This is a chart of the United States updated this week from the World Health Organization of how much COVID is ongoing in the world right now. Each day, we have almost 500,000 new cases of COVID every day, okay? This is not over. It's still going rampant. Again, almost 400,000 new cases every day. 400 today, 400,000 tomorrow, 400,000 the next day. We have over 67 million confirmed cases worldwide. But this is, most experts say this is probably half the true number. There's so many people, especially in developing countries like India or other countries, where they don't even get tested, and so that doesn't get confirmed as if you don't have a positive test, it never gets put in the count. And that's actually the rule in every country. If you don't have a positive test, they don't count it as a COVID test. So if you just die from COVID, but you never got tested, it doesn't even get counted in the deaths or the total count. This is the number of deaths. So every day in the world, 8,000 people die every day from COVID. And again, this is just the number of counted deaths. These patients had a positive test. If you didn't have a positive test, again, the countries with less resources for testing, it doesn't even get counted in this number. So it's, again, a very small number. It's probably far higher, over almost 3.5 million deaths so far in the world in just the past year. Again, probably far underestimating the true situation. And here's the good news. In the last several months, since vaccination has been rolled out, 1.5 billion people in the world have been vaccinated. So for anyone who's still a little hesitant, I'd like to tell you 1.5 billion people have already been vaccinated in front of you. This is safe, okay? And 700,000 people have okay, so I'll keep going. So what we can see here in this chart from the CDC, it is a couple weeks old, I didn't update it recently. You can see in the United States, we really started rolling out vaccination to the general public around March, April. Maybe in February, some of the older people we were allowing January, February, but then really, getting to the middle-aged people. And what you can see is, you have to wait 2 weeks after your last vaccine, so it's going to take a solid 5-6 weeks to get vaccinated. And what we see is a huge drop in the number of new cases every day now in the last couple months. And we believe this is due to vaccination. So really, we are seeing benefits of vaccination. There are 3 different vaccines available in the United States. First, let me just start by saying, in the United States, as well as Western Europe, we have the most rigorous medication vaccine safety possible in the world. There are some countries that have no such agencies, and maybe the government doesn't allow transparency, but there's no question in Western Europe and the United States, we have numerous organizations that are watching everything so carefully to ensure our safety. And I am, to the point that any physician, would vouch for it, would bet their life on it, that, we can trust our authorities. So we have the FDA, the ACIP, the CDC, numerous agencies that have reviewed vaccine safety, these exact vaccines that we're giving today in the United States. And they've reviewed more than these 3 vaccines, and they didn't approve some of them. So it's not that we approve everything. There are numerous vaccines the United States did not approve. But we did approve Pfizer, Moderna, and Johnson & Johnson, also abbreviated J&J. And numerous experts have, including Henry Ford Health System, we were actually part of several of these trials back last year in 2020, and we have all looked into the safety of this. What, I can summarize this very complex slide very simply. Let me start by saying When you're exposed to something, whether it's a virus, an infection, a bee sting, we call that bad thing the antigen. And then your body makes something called an antibody to fight the infection. These new mRNA vaccines, which are both Pfizer and Moderna, they have these vaccines have been formulated to tell our body to form an antigen protein so that our body automatically makes a response antibody in response to fight. And so it's basically a way of preparing our body to make antibodies before we've been infected with COVID, so that if someone exposes us to COVID, our body already has the defense system up and running to then fight any potential exposure. Let's say you're at a party and someone coughs on you and they have COVID. If you've been immunized, you already have this immune system in your body with antibodies floating around because the vaccine has already prepared your body for this. Now, I'll say this multiple times because this is such a misunderstanding. These mRNA, I think people recognize the word RNA, so they think genetics and they think this is changing our genes. This is not entering our genetic cells. This is not entering our gene pool. This is not changing our genes in any way, our genetic material. So that, I think people don't know enough about the science when they make that assumption. So that's actually not true. Johnson & Johnson is the more traditional, a different method. It's using a viral vector. It's using a piece of a different virus, not the COVID virus, and it's going into our cells. And again, similarly, programming our bodies to make an immune response and make antibodies to fight the infection in the future should we encounter it. All three vaccines do not change our genetics and are very, very safe. So just briefly, as I mentioned before, on the right, Moderna and Pfizer are both mRNA vaccines. What you will hear, so I think we should just talk about this head on. You know, people say, well, I've heard J&J is not as good, or what do these numbers mean? So in the vaccine trials, Moderna and Pfizer did have high efficacy, 95%, which means it prevented 95% of the cases of COVID that would have been transmitted. It prevented the vast majority of people who would have been infected no longer got infected by having the vaccine. And just to give you a background, 95% is astronomically high for a vaccine. As an example, the flu vaccine that we get every year is about 50 to 60% effective. So that's, 50 to 60% is pretty standard. So this efficacy is almost like a miracle. And we're so lucky that, we had such smart, scientists that could help, create something so effective. Now, when you look at the Johnson & Johnson, they might say 70%, 72% effective. What does that mean? Well, yes, it's true that in the trials, there were higher rates of infection, but the good news is, which I'm going to show you in a minute, there were in fact, in the trials, there were no deaths from COVID, meaning maybe more people got mild cases or moderate cases of COVID, but the Johnson & Johnson or J&J vaccine was extremely effective in preventing serious COVID infections and deaths. So overall, the most important thing, of course, is survival and not getting critically ill. And Johnson & Johnson was equally, very, very good at that. One of the advantages of Johnson & Johnson is just one shot. And that's the big difference between that versus Moderna and Pfizer are 2 shots that have to be given either 3 or 4 weeks apart. And of course, it's actually very hard for the people giving the vaccine. They have to store it in sub-zero temperatures. One thing that's changed right away is I saw, that Pfizer is approved down to 12 years of age. So my 13-year-old daughter, I got her the vaccine the first day she could get it. This, number one priority is protecting my family, protecting our loved ones. And I saw that Moderna has asked the FDA to review their safety data, also showing that. So I anticipate in the upcoming months, you will also see Moderna coming down to 12 years and older. As of now, Pfizer is currently the only one available as well. So it is a myth that, it is, what is true is that J&J is very, very effective at preventing hospitalization and deaths from COVID. Even though people might have a small increased chance of getting COVID compared to the other two vaccines, J&J is very effective in preventing really serious infections. I just want to show you this chart. You may have heard in the news that about J&J having blood clots. Well, it's true. There have been about 15, 20, almost 30 cases now of blood clots in 8 million people, okay? So we just want to give you a perspective of what this is. If you actually get COVID infection, you are at tremendous risk of getting blood clots. And I'm not saying that you even have to be hospitalized or on life support with COVID. Just being at home with COVID gives you a tremendous risk of blood clots. It's an inflammatory disease that affects all parts of your body, including potentially your brain, your heart, your kidneys. So, the risk of blood clots with COVID infection, actually getting COVID, is astronomically higher than any blood clot risk with vaccine. So that was the main point I wanted to show you. Yes, it's true that there were a few cases. And what I would say with the Johnson & Johnson vaccine is if there's any concern about blood clots, most of the cases were shown mostly in women and mostly less than age 50. And if you've already gotten your J&J vaccine and you don't have a blood clot, then everything's great. So again, there were only a couple dozen cases in 8 million people. I do want to emphasize this repeatedly. There were no corners cut. I think, I've spoken to many groups, many different cultural groups, many different religious groups, many different age groups. And, a misconception everyone says is it was too fast. They came out with the vaccine too fast. They must not have, checked it. People are thinking corners were cut. That's absolutely not true. It actually went through every single thing that normally is done. A couple of things people need to know is actually the mRNA technology has been around for over a decade. And they were actually studying it, for a long time. And we actually had used the mRNA technology in other medicines, including some chemo drugs and other things. So it's not new and experimental. What I do want to show you again is this. So if you look at the science behind the COVID vaccine, usually, vaccine companies, they're not as transparent in showing us the detailed data, but because of the concern about COVID, most Western countries, is what I'll say, have freely shared the detailed results of all of their vaccine trials. We completed all the same phase 1, phase 2, phase 3 trials. Normally, vaccines will only have, or even drugs will only have maybe 20,000 participants in the trials. COVID, we required 60,000. So again, we actually had many more people in the trials compared to normal. We had all the same regulating groups regulating safety for us, which again, we have the highest standards in the world for that, as well as, so all of these things to be true. Now, 60,000 you may say, and I understand if someone in November of last year says to me, well, 60,000 people is not a huge number of people. I'd like to wait till there's more people who've had this vaccine. We're talking about billions of people now in the United States have had this vaccine. So, we now have safety data for hundreds of millions and even billions of people. So a couple things I want to make clear to everyone. The vaccine has no live virus in it, and it cannot scientifically possible. It is not possible for the vaccine to actually cause someone to get COVID. There have been many cases. I've taken care of them myself. They got vaccinated yesterday. Today, they're sick in the hospital with COVID. You know what? They've actually had COVID for 1 week. COVID incubates for a couple of days, and it does take 2 weeks after your second vaccine to be fully protected. But there's no possible way you can get COVID from the vaccine at all. They're not live vaccines. What you'll do is after we give you the vaccine, we'll watch you for 15 or 30 minutes afterwards just to make sure you're fine. And, and I want to make clear, there's only one single group in the United States who cannot get the COVID vaccine. Only one. And again, right now that's for 12 and older. And there's studies right now going down to babies. Those are ongoing. So right now, for anyone 12 and older, there's only one group of people who cannot get the COVID vaccine. And it's if you've had a severe anaphylaxis allergy, severe allergy to prior vaccine. Like, let's say you got the flu shot before, you got, the tetanus shot or some other shot, and your throat closed up and your lips closed up and your tongue was swollen and you started wheezing and you couldn't breathe, and then you got rushed to the emergency room, and then they had to give you multiple medicine injections to be able to, and you were turning blue. That's the group that cannot get vaccinated. Everyone else can get vaccinated. There's, unless your doctor has told you you have a severe allergy to something and you can never get this again. Because I'll tell you, it's pretty normal to have a reaction to any vaccine. People tell me, oh, I didn't feel that well after the flu vaccine. I must have an allergy. That's not an allergy. So a lot of people tell me, especially in my own community, oh, I can't take this vaccine. I didn't feel well after it. That's not an allergy. That's actually just our immune system being turned on and getting ready to fight a future infection. So that's not the same thing as allergy. Okay, so talk it over with your doctor to see if they agree that you have an allergy to a vaccine, a severe allergy. Anything else is not a contraindication. You can drink alcohol, you can take any food allergies, any medications, if you have allergies to anything else like medications, food, pets, or plants, that does not interact with the COVID vaccine. And similarly, you can have any health condition. You can have cancer, you can have, some people ask me, oh, I drink a lot of alcohol. Is that okay that I take the vaccine? Absolutely. I have these other conditions. Can I take the vaccine? Absolutely. I do want to just say in general, people who have a weak immune system are actually at the greatest risk to do poorly from COVID. They're at the greatest risk to be seriously hospitalized and to even die. So actually, the people who need the vaccine the most are people who are immunocompromised or have a weakened immune system. Pregnant women are actually immunocompromised. When you're pregnant, your immune system is weaker. And we actually have scientific data that's been well published that pregnant women and immunocompromised patients, if they get COVID, they do much worse on average than someone who is not in these groups. So the general information I want to convey to you is actually these groups need more protection than anyone else. You actually need to be more protected. In general, what the CDC says is that pregnant women should be more protected. They're at increased risk from severely doing poorly from COVID, them doing poorly or losing their baby. So far in animal studies, as well as our registry. So we've gotten over 100,000 women in the United States who are pregnant and have taken the COVID vaccine, and there is no red flags. Everyone has done equally well as a non-pregnant woman. So again, nothing to be concerned about that. The CDC has been monitoring all of these women, and they keep a registry, okay? So they're continuing to monitor this, and the official recommendations is that pregnant women should have a discussion with their OB-GYN about getting the vaccine. In general, such as at Henry Ford, all the women that I knew that were physicians and pregnant, they rushed to get the vaccine back in November, December as soon as they could, because they were thinking about how do I best protect myself and my baby from getting COVID. Now, side effects from vaccination, they usually occur within the first 72 hours, and they usually only last 1 or 2 days at most. And it can have more effects on the second dose than the first, but not necessarily. I actually had more effects on the first dose. I had no effects on the second dose. We do see more side effects in younger people. Let's say you're 20 to 30, years old. Maybe it's their immune system that's showing a stronger response. And only 2%, 1 in 50 people actually feel not well enough that they can't do everything they normally do. Maybe they're so tired that they just kind of need to lay in bed for that day and then they're fine the next day. That's 1 in 50. That means 49 out of 50 people did everything they normally would do. They went to work, they mowed the lawn, did all those other things. We really do think it's very safe. So what are the side effects you can expect? And I think I heard from this group here, they can vouch for this. Some people might be fatigued or tired. You might feel a little dizzy. Some people developed a headache. One is a common thing is getting pain where they inject you. My arm was sore. A more severe symptom that's very, very uncommon in most people is the chills and fevers, especially in the older group. In some of the immunizations, they've gotten swollen lymph nodes in the armpit of the arm that you got injected in. Again, I want to emphasize this to you because, again, I've talked to hundreds and hundreds of people going to visit, synagogues and mosques and churches and visiting cultural groups. People say to me, everybody, I visit, community centers. People say, oh, I really don't want side effects. Any potential side effects are at most 1 to 2 days. So I tell people, you really need to consider this. Would you rather have potentially a day of some minor side effects, or would you actually rather get COVID? And it's really not the purpose of today's talk to go over COVID, but COVID is a devastating disease. You feel pretty sick in many cases if you're lucky enough to just stay at home. And you're going to feel much worse than 1 or 2 days. Most people feel very ill. They're home, they're exhausted. They can be sick for 1 or 2 weeks at home. 20% are so sick that their life is in danger and they have to be hospitalized. And you, again, saw the numbers earlier. Millions of people have died from this. So it's really not even comparable. And I guess another thing I can reassure you is think about all the other vaccines you've taken. Many of you have taken the shingles vaccine. Many of you have taken the flu vaccine. Same thing. Sometimes you take the flu vaccine, you feel a little under the weather for a day, and then it's gone. No big deal. And that's really very similar to this vaccine as well. So, what you can do if you're at all worried about the side effects is after you get the vaccine, we prefer you to take Tylenol instead of Motrin or Advil. And you can start it after the vaccine, not before. And again, it's really very, very short-lived. Most people don't even take Tylenol. And like I showed you that prior slide, most people are not even affected. They go 49 out of 50 people did all their normal activities after vaccine. There's only one thing with the timing of COVID. This is a question I get all the time, not just from patients, but from doctors. Is there a time I need to wait to take the first shot? And we actually, up until a week or two ago, one rule used to be is if you had a vaccine for someone else, let's say you had the shingles vaccine, we always said you have to wait 2 weeks before you could get another vaccine. The CDC has taken that rule away. So now you can get as many vaccines as you want. You can get the shingles vaccine yesterday and you can get the COVID vaccine today. So first of all, that rule is taken away per the CDC. So they have enough data now to know there's no interaction between the vaccines. So a second question people ask me is, oh, I got COVID last two months ago or 1 month ago. Should I wait to get vaccinated? No. CDC says don't wait. Everyone needs the COVID vaccine. If you had COVID 3 months ago, you should still get the vaccine. If you had COVID 2 weeks ago, you should still get the vaccine and not wait. The only rule of waiting is you should not get the vaccine within the first 10 days of actually having COVID. Most primarily because you actually are still infectious to other people. So when you actually have COVID, you have to quarantine and isolate for 10 days. And so yes, you should not be walking into a center to try and get vaccinated those first 10 days. Other than that, you should get vaccinated. So let's say you had COVID last month, now is a perfect time, get vaccinated right away. There's no benefit for waiting. And we do worry, we don't know how long getting COVID, might give you immunity or protection. The only thing that we do, there's only one thing that you should wait. There's two treatments of COVID that are done in the outpatient setting. One is called convalescent plasma, and one is called the monoclonal antibody. So if you actually got infected with COVID and was treated with either of these treatments, then because we already gave you these treatments that would interfere with the vaccine, we say wait 90 days. So again, only if you've had COVID and have had the COVID treatment of convalescent plasma or monoclonal antibody do we say wait 90 days and then get the vaccine. Everyone else, get the vaccine now, okay? Couple quick things I'm gonna go through, and then hopefully the next 10 minutes, I'm gonna have to talk faster. There's no allergies or latex or any kind of allergy you have, you can take this COVID vaccine. It doesn't matter what health condition you have, anything you have, again, cancer, hypertension, heart disease, anything you can think of, you should get the vaccine. You are not fully protected until 2 weeks after the last dose of the vaccine. So really, when you start your vaccination series of, say, a 2-shot vaccine, it really is going to take close to a month and a half to get fully protected, okay? I will actually save this discussion about masking because I know the CDC just changed their rules. So let's save that to the end. I want to get through the slides. We don't know if people are going to need to be vaccinated every year, but we suspect we may need boosters. I would not be surprised. Kind of like the flu shot needs a booster vaccine, a vaccine every year. I would not be surprised. We're studying, the United States, the world is studying this right now. We're going to, we look and see, when do your antibodies go away? How long does the vaccine last? You can get vaccine if, it's not contraindicated if you're breastfeeding. There's no warnings against that. We ask that you discuss it with your physicians. There is no evidence that fertility and childbearing women, that there's any danger. Again, we have billions of people who have taken this vaccine. There's nothing to suggest it would affect pregnancy, okay? It is true that if you take the vaccine in a very small number of people, because it's making your immune system turn on and get strong, our lymph nodes are our immune system. So the lymph nodes right in our armpit next to the arm that got immunized, in a small number of people, that lymph node gets swollen. And that's just your body is just turning on its immune system. It's nothing bad, it's a good thing. But that can potentially cause a false positive mammogram. So then you should just get another mammogram. You should get a mammogram a month after getting the vaccine, not during the time you're getting a vaccine. The best vaccine to get is the one that you can get the soonest. We do not recommend you hold out for one vaccine or another. All three are considered safe and all three are considered effective. If you are a Henry Ford patient, you can ask your Henry Ford doctor to put an order into Epic to order the COVID vaccine for you, and you can schedule the COVID vaccine. There's many, many other places that have the vaccine, CVS, drugstores. I think I saw Costco, Meijer, the health department, Cobo Center, which is now named TCF Center in downtown Detroit. There's so many places that you can get the vaccines now. And you can go to this website, Michigan.gov, coronavirus, to learn more about vaccine availability. But really, 4 months ago, yes, it was a race to try and get the vaccine. But right now, it's wide open. There's really no barrier for someone to be able to get the vaccine. If you have symptoms that are suggestive of COVID, you should still get tested. So you should talk to your doctor about that slim possibility. And we're going to talk about that. So let me give you a couple facts really quickly. Again, it is not true that you can get COVID from the vaccine. It will not change your DNA or your genetics. You are unlikely to have severe side effects. That's absolutely true. It's very unlikely that would happen. It's just like other vaccines where there might be some mild side effects. It is not true that this causes infertility. There's no evidence for that, and it's considered safe. And this was not rushed. There were no shortcuts. Other myths is that, again, there's no dangerous side effects. I'll tell you the truth is there are no dangerous side effects for the vaccine that we know of. And, I even heard a myth that someone told me that oh, there's a microchip in the vaccine and now the government's tracking us with the vaccine. Okay, that's absolutely not true. So these are all myths. So some good news. Last 2 days ago, CDC announced that 50% of the adults in our country are fully vaccinated, have had both vaccine shots. It's been 2 weeks afterwards. That's pretty good news. We're on the way to protecting our families and ourselves. We've given 288 million doses of COVID vaccine, and half of the United States is over 123 million adults have been fully vaccinated, for adults that have been vaccinated when I say that. Again, I want to show you this chart on the left is new cases of COVID each day, and this is worldwide. We still have every single day 400,000 people newly diagnosed with COVID in the world every single day. And every single day, about 10,000 deaths every single day. So we really need to take this pandemic seriously and do everything we can. We all want to return back to our lives and be able to see our friends and family. So I actually am down to the last 2 slides, and then I can take questions. I put this together by looking at the CDC website and getting all the data. I think this really, because this is actually the 3rd most common thing I hear from people. Well, if the vaccine can't prevent COVID 100%, then I'm not going to take it, is what people say to me. I've heard that there's breakthrough cases and it's not 100% effective, so why should I take it? Well, that's like looking at the half full, half glass empty philosophy. You can look at it negatively or you can look at it positively. And these are the numbers. From January 1st to April 30th of this year, this is 4-month period, this is what they did. We know half the country is immunized. And so far, the CDC is tracking all the breakthrough cases. And today, 2 days ago, they released the data. There was about 10,000 cases of people who got COVID of the 123 million who got immunized. So it's true. It is true. It's not 100% effective. And we already knew that. We already said that the vaccine was 95% effective. So out of 123 million people who were vaccinated, 10,000 did get COVID after they were fully vaccinated. If you look at what percentage of number that is, your odds of getting COVID if you were vaccinated is 1 in 10,000 will have a breakthrough infection. So your odds have now just fallen to 1 in 10,000 if you get vaccinated of getting COVID. That's extraordinarily low. In the same time period, from January 1st to January 30th, if you look at the half of the country in the United States, this is not worldwide numbers, these are all United States numbers, 70 million people in the United States who were not immunized got COVID infection. So now you get to really compare the difference between being vaccinated and not being vaccinated. So if you split this country in half and you say on this group, this half the country got vaccinated and this half did not get vaccinated, half did. The number of people infected in the vaccinated protected group was just 10,000. And the number of cases in the other half that didn't get vaccinated was 70 million. And so, yes, when someone says to me, well, is it true I can still get COVID? Why should I bother getting it? It's because of this. Would you rather be part of the 70 million? Your odds are so much higher versus 10,000. And so really when you compare these numbers and I did my old math that I learned in high school and I reduced the fraction. For every 1 breakthrough case for someone who's vaccinated, there were 7,000 cases in the non-vaccinated group. And that's why we're getting vaccinated, because you can reduce your chances from getting COVID thousands of times lower by getting vaccinated. It's not 100%, but it's astronomically lower. And so this is the best thing we can do right now as part of how we protect each other, our families, and ourselves from getting COVID. So this is the very last summary slide, and then I can spend the last 20 minutes taking any questions. COVID can be a very serious disease potentially even life-threatening. They've talked about in different articles, even people who recover from COVID, some of them feel very tired all the time. Some people, have symptoms that last for months and even a year now later, they've described it. So it is a very, very serious disease that has caused millions and millions, tens of millions of people to die in the past year. I'm telling you that COVID is not going to be cured and eradicated from our world for many years to come. If you tell me COVID is going to be cured and there won't be a single case in 5 years, I just don't believe that's true. I think we will have COVID in our communities and across the world for our foreseeable decade, maybe many decades, kind of like the flu. It's there. So, but this is much more serious than the flu. And that's probably the best analogy I can make. Most people don't die from the flu. This is very, very serious. And again, tens of millions of people across the world have died from COVID. I think 600,000 have died in the United States in just 1 year. So getting everyone vaccinated against COVID is the most effective way of providing significant protection against getting infected with COVID. If you and all your family and all your friends can get vaccinated, it will help keep everyone safe, okay? All the medical experts, all the scientific medical experts, because I know there's a lot of people talking in the media or on the webpage or on the internet, but if you actually see who's talking, all the scientific medical experts agree that getting vaccinated is so tremendously more safe than getting the risk of getting COVID. There's no question about this. And you can see that the safety of these vaccines has been proven many times fold. And you know what is a great example I want to give you? People tell me there's not enough safety data with the COVID vaccine. I'll give you an example. Let's say you take a high blood pressure pill. Maybe 100,000 people in the world take your blood pressure pill. If it's a blockbuster, a hit, if it's the #1 blood pressure pill, maybe 1 million people take your blood pressure pill. You got 1.5 billion people who have taken the COVID vaccine. So more people have taken these vaccines than any other medication or vaccine before. So we have more safety data than anything else. So really, the safety data is clearly there. This vaccine is proven to be highly effective in saving lives and decreasing infections. And you can see that in the last slide I showed you. So that's it for me. I hope this was an overview about COVID vaccine. I hope I've helped to reassure you if there's any hesitancy, now we have a year's worth of data and hundreds of millions of people in the United States have taken it. Our exact 3 COVID vaccines in the United States, you have over 100 million people who have been fully vaccinated. And that includes people at 100 years old, people at 12 years old. So no matter what age you are, you don't need to worry. So what questions can I take for you today?
Doctor, I have a question regarding people who have had COVID already.
Yes.
Don't their body already generate some antibody?
Yes.
Why would they want to rush out and get the vaccine?
We don't know how long the antibody lasts. Let me stop sharing. We don't know how long the antibody lasts. So for that reason, the CDC recommends that everyone, and they specifically say, including people who have had COVID, need to get immunized. Also, I would point out to you, if you got COVID in 2020, you don't even have the same COVID variant that's circulating now. So now we have the B117 variant. That really wasn't in the United States in 2020. So if you got infection in December of 2020 or prior, you got infected with a different variant. So your antibody is against a different COVID strain. We do know that the new vaccines are showing pretty good efficacy against the new variant strain B117. So there's numerous reasons, but bottom line is, if you look at the CDC website, they say everyone, including people who have had COVID, should get vaccinated and should not delay.
Thank you. I have another question before going to the chat. If someone, now we're looking at having a booster shot, a third shot. So for Moderna and Pfizer, the technology is using the mRNA. Could say one person who had 2 Moderna and decide to take the 3rd one using Pfizer?
That's an excellent question, and they're studying that and looking at that right away. But I am hopeful that that may be possible, because it would be. So they're looking at that right away, but and more information to come from the CDC. But I wouldn't be surprised if they allow people to go between the 2 mRNA viruses vaccines.
So for a follow-up question, then J&J is a different technology.
It's a different technology. It's a viral vector. So
Right.
It is not the same, and that's a little bit more complicated. So again, they're looking at that too. If you had J&J in the past, are you allowed to get a booster? Could you get a yearly booster with the mRNA? I mean, they're definitely going to look at it, and it's definitely going to happen. It's really not going to be realistic to, force someone to maybe get one kind of shot every, for the rest of their lives. So they are looking at this data, but they have not, we are not clear yet, but it will become clear.
And another follow-up question on that. So now we are looking at the efficacy. For J&J, it says it's 70%, which is certainly lower than the 95% we're looking at Moderna and Pfizer. So for someone who initially that was their only choice to get J&J, and now they say, well, there's plenty of vaccine out there now. Can I go out and get 2 more shots from either Moderna or Pfizer? What would happen?
We're not allowing that. The United States is not endorsing that at this time. They're not saying, so no, the CDC is not recommending that if you got J&J up front, that immediately you're going to go switch and do another vaccine right now. But again, they are looking at many things, including, let's say you need your yearly booster, can you potentially switch between vaccines? That is something they're looking at.
Thank you.
So I see in the chat someone asked, for people who have been vaccinated in January, and that's me, I got vaccinated in December as a healthcare worker, how long will the immunity last? And that's exactly what they're studying. So in patients and volunteer subjects, they're drawing their blood all the time and looking at the antibody level of vaccine. And that's one of the ways they're looking at how long will the vaccine last. We look at how long the antibody levels stay high. Another way they're looking at the rate of breakthrough infections. So, if we start seeing breakthrough infections that become a higher percentage as you reach maybe month 9 or month 12 or month 15, that would be another way that they are monitoring this. So they are looking very hard, but we don't know the answer yet. We do have data that's been released by scientific community and published that, clearly 6 months out, people already still have strong antibody response. But again, when we might need another booster is still being determined. We haven't gotten it, and because the vaccine was just released in the last year, and that's why we don't have long-term, does this last 5-year data, and that's going to have to go, as we say. It says timing for pregnant women to get vaccinated. Again, I don't think that there should be a delay. I think if you're going to get it, the sooner the better. Better to be protected throughout your pregnancy instead of trying to go through part of your pregnancy. Again, CDC says that pregnant women should consider and to have a discussion with their OB about getting it. Henry Ford has supported that. And again, we had many pregnant doctors in our healthcare system who immediately got it last December. What type of vaccine is preferred? There's not a preference. They didn't say there's a preference, the mRNA or the viral for pregnant women. Okay, any other questions I can answer for you?
Okay. You mentioned that your 13-year-old got the vaccine. Does he or she have any side effects?
She said she felt a little tired the next day. She usually, she's on a travel athletic team, which means, it's pretty intense. And, we sometimes have, she'll sometimes run for an hour to work out. And she didn't feel like running an hour the next day, but then the day after that, she did. So, she felt, and that's actually kind of how I felt. So, but what I would say is there's this is such a small thing to feel a little tired, or even the worst case scenario. Let's say you actually had a fever and didn't feel well and couldn't get out of bed for one day, which again is very rare. Very, very few people feel that way. Again, 1 out of 50 would feel that sick who got vaccinated. To me, it's such a small thing compared to actually getting COVID. And so I have 85-year-old parents. They moved over to the West Coast after they retired to California. Me and my sister were working really hard in January, February, calling every single location, trying to figure out how are we going to protect our parents. I want them to get vaccinated, and they were in it, and we did. We figured out a way to get where could they go? They were actually vaccinating at Disneyland. How do we get them vaccinated the first possible day? Same thing. I have a 16-year-old son, and the very first day that they allowed it to not be elderly adults and lowered it to all adults, my 16-year-old got vaccinated immediately, and then the next would be as soon as they allowed down to 12-year-olds, my 13-year-old got vaccinated. There's not anything we wouldn't do. All of us, we all want to protect our families and our loved ones. And there's no question that this is the most important thing you can do to protect them. I certainly don't want my family to get COVID, and I even worry more about the long-term effects. There are a lot of people who have really serious long-term effects from COVID. And I certainly don't want my kids to be, they talk about concentration problems and memory problems and depression and all sorts of things, and fatigue and tiredness and breathing problems. That's not something I want my kids to have for the rest of their lives. So, I definitely think protecting all of our family and our friends is spread the word. If you have family, cousins, aunts, uncles, grandkids who haven't gotten vaccinated, really it's the best ways to get them protected. I was going to say something, it's a little controversial. I didn't finish that one sentence I said I would get to at the end about masking. So, it's confusing because I don't think the CDC, they say it, it's true what they say, but then people misread what the CDC says about masks. This is what the CDC says. If you've been vaccinated, you don't need to wear masks. But what they're really saying is, if you haven't been vaccinated, you must wear masks. So that, and if everyone followed that rule, that everyone who didn't get vaccinated continued to wear masks, I would feel relatively safe taking off my mask, in front of someone else if they were also vaccinated. But this is the problem in this country. We're not wearing a badge. We don't have a bracelet. There's no way to know who's been vaccinated. And I suspect that there are many people who don't get vaccinated who will not wear a mask. In fact, half this country has not wanted to wear a mask this entire time, despite millions and millions of people dying. So it's a little bit trickier. This is my personal advice that I'm just giving from an infectious disease standpoint. If you're indoors in a room with a lot of people and you don't know their vaccine status, they're not your good friends and your family and, who will be truthful and honest and want to share that information. You kind of have to assume some of those people are not vaccinated. And then if they're not wearing masks, they're still contagious. And then it's up to you what you want to do with your mask. I think indoors is very different than outdoors. I think knowing how many people are in the room and if you know their vaccine status all plays a factor into how I act with my mask. So if I'm in a very crowded room with a lot of people and it's indoors and I don't know if they've all been vaccinated, I would probably, personally, as a personal decision, I might choose to wear my mask indoors. Again, that's my personal decision. If I am with friends and family and I know they're all vaccinated, I would be comfortable taking off my mask because the risk would be extraordinarily low. Again, you just have to weigh the risks you're taking. The vaccine is 95% effective if you've got Moderna and Pfizer, but not 100%. And so if you had someone with COVID coughing on you, it would protect you most of the time, but not 100% of the time. So again, you just have to make your own decision. I think outdoors is extraordinarily safe. I'm very comfortable not wearing my mask outdoors. You know, the circulation in the outdoor air currents is a million times greater than, you know, just being in a little room with a lot of people. So outdoors is really, really, really safe. Unless you're in a very, very big crowd, then that's very different. But, you know, you're just taking walks or you're outdoors at a picnic and, you know, I think it's relatively safe outdoors. So I guess that's all I'll say. But I do want to say the CDC doesn't contradict what I said. It's just that, you know, what they said is if you're vaccinated, it's safe for you to take off your mask. But if you're not vaccinated, you should wear your mask. And again, if everyone followed that rule, that would be fine. But the problem is in this country, everyone's not going to follow that rule. And that's why it gets complicated about masking, especially indoors. That's what I'll leave it at. Okay. Any other questions I can answer for you?
There are 3 more in the chat.
Okay.
How effective?
Okay, so I'll do the last one first. So Pfizer and Moderna have shown pretty good efficacy against the B117, which is that actually is the new strain in 2021. It actually, you know, part of the problem in Michigan was when you saw that spike in March, we had one of the highest rates of the B117 in the country. And it actually causes the majority of COVID infections in Michigan is the B117, and both Pfizer and Moderna have shown pretty good early results with that. I don't know if I've seen any J&J data, so I'm sorry, I don't know about that. Any marker left on our DNA? No, for an RNA virus infection? No, I don't think, I don't know if I'm reading that correctly, but someone's asking, can we see it genetically if we've had an infection? No, I don't think, I've not heard anything like that. This doesn't affect our DNA. The infection doesn't affect our DNA and the vaccine doesn't affect our DNA. Now, antibodies is something different. When you have infection, your body makes an immune response called an antibody, and you can check your blood for antibodies to see if you've had a prior infection. We can check our blood for, say, chickenpox antibodies to see if we've had chickenpox. We can check our blood for COVID antibodies to see if we've had COVID in the past. We can check our blood for hepatitis antibodies. Have you had hepatitis C, which is common in many Asian countries? So you can check your body sometimes for antibodies, but that's not the same thing as DNA. That's not DNA. That's just an antibody immune response, and you can check that in the blood. Okay, so we're wrapping up. It's 2 o'clock.
Just a last question. Do we have data in Michigan? How many people they haven't taken the vaccine? Or
yeah,
how
I think Michigan's over 50%, so of adults. So we're, you know, that's, I think, let me go back. Let me see. So it was, I think, here it is. So we are this color that looks between 50 and 60%. So, you know, between 50 to 60% of our, you know, at least 50% of our state of adults has been fully vaccinated. Now, that doesn't include children, which they just started. And I'm not, you know, so that's where we're at. Okay. Okay, everyone.
Thank you. Great info. Thank you very much.
Well, everyone stay safe out there. You know, spread the word, encourage your friends and family to get vaccinated. You know, the saddest thing for me, I'm still in the hospital and I still see people die every day from COVID. Every day, people pass away from COVID in front of me. I'm an infectious disease doctor, so I see all of these COVID patients. I've seen them for the last, year and a half. It's I've been part of their care in the hospital. And what's most sad to me is almost 100% of these patients, they didn't get vaccinated. And I think to myself, most likely this patient wouldn't have even gotten COVID, let alone died from COVID, if they could have gotten vaccinated. So please, we want everyone. That's why when I go to every community, it doesn't matter age, race, culture, religion. We just want everyone to get vaccinated. I don't want any group to be left out. And we're so lucky in this country. You look at other countries, you see the terrible loss of life in India right now. They don't have the same access to the vaccine we do. Here we can get vaccinated. Some countries don't even have the vaccine, even though they want the vaccine. So we shouldn't, we're a very wealthy country, and it would be just such a terrible loss for anyone not to be able to take advantage of the wealth and resources that our country has put, into providing this vaccine for us. So I just want everyone to be protected. Okay, thank you, everybody.